Photo. I'm Jane Liggins. I'm one of the cardiac nurses here at the Heart Foundation. Welcome to our Heart Help Live series. A warm welcome to anyone joining us for the first time, and welcome back to our previous viewers. This week's topic is exercising after a heart event or heart diagnosis. It's important to note that this session isn't intended as a substitute for professional medical advice. So keep your doctor or cardiologist informed about returning to exercise. I'd like to introduce you to Eleanor Natrass and Ellie Rickman, who are both registered clinical exercise physiologists. Eleanor has a master's degree and Ellie has a PhD in this area. They've worked in private practices catering to a wide range of chronic health conditions. Eleanor is currently also a board member of Clinical Exercise Physiology New Zealand and was the previous chair. Clinical exercise physiologists specialise in using their knowledge of how the body responds to physical activity to create personalised exercise plans for specific health conditions and injuries, such as heart conditions. They support people to achieve their recovery and fitness goals safely and effectively. Now, Ellie and Eleanor have vast experience in helping people recovering from heart events, such as heart attacks, heart bypass surgery, stents and heart valve surgery. They also help people living with heart conditions such as heart failure, atrial fibrillation and cardiomyopathy. So the advice today will be general in nature and focus on how you can safely exercise independently at home or in a gym. There are also specialised health professionals such as clinical exercise physiologists and physios who can help. Do remember though, if you have any medical concerns, please discuss them with your doctor. Now, a very quick little housekeeping. If you do have any questions during this presentation, please feel free to add them to the comment section and we'll cover as many as we can during our Q&A. Please don't include any personal details that others might see. Now, without further ado, it's my absolute pleasure to hand over to Ellie and Eleanor. Welcome, it's so lovely to have you here today. I've been really looking forward to this session. So tonight we're going to be talking about exercise. Ellie, what sort of exercise is important, or why is it important in the context of heart health?
Thanks so much for having us, Jane. And I think, again, that's a really good question just to kick off the night as well. So when we look at where exercise plays and how it plays an important role in heart health, we know that it reduces a lot of our traditional cardiovascular disease risk factors. And so when we think of those things, we think it reduces our blood pressure. Again, it has positive effects on our cholesterol levels, in particular what we call our HDL, or our good cholesterol with that. It also reduces and helps us regulate our blood sugars for those that might have issues like diabetes. And again, it helps in our weight management as well. So besides reducing and improving those traditional cardiovascular disease risk factors, what we also know from a lot of the research and evidence out there is that individuals that have a high cardiorespiratory fitness level or an aerobic fitness level have certainly lower mortality rates. Again, we also see that individuals that have gone through a structured cardiac rehabilitation program, which again includes exercise as a big fundamental core component, but also things like smoking cessation, again, optimal medical management and nutrition advice. We see that those individuals has reductions in death rates. Again, they also have reduced hospitalization rates. And more importantly, again, they have a reduction in the need for any future interventions. So that could be things like having to have another stent if they've had one, or also, again, open heart surgery as well.
Perfect, Ellie. So if you have a cardiac condition or recovering from a cardiac event or surgery, it's really important to exercise because that's going to reduce your risk of another heart event. It's going to reduce your risk of having to go into hospital, and it should help with your living a long, normal, healthy life.
Absolutely.
Perfect. Thanks, Ellie. Eleanor, how should people start out with exercise, particularly those who've never done any before? And are there any sort of current guidelines that they can use?
Yeah, thanks, Jane. Absolutely. So I'll break that down into two parts. So first, looking at what to do to start. And this can absolutely vary depending on what your baseline is. But if you're new to exercise, you haven't been doing anything structured for a period of time, then one of the good things is you can actually break your exercise up into smaller bite-sized chunks. So for instance, if the guidelines are 30 minutes a day, then you could be breaking that into, 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening. And that all still accumulates towards that 30 minutes a day, which is wonderful. You don't just have to do one style of exercise. There's so many forms of exercise. And the most important thing is finding something that you really enjoy, because that's something that you're going to continue doing. If we look at kind of the second part of your question, which is, general guidelines, what are they? We want to be accumulating 150 minutes a week of moderate intensity exercise. So 150 minutes, if you broke that down into 30-minute chunks, you'd want to be getting that in on 5 days of the week. But if you can't, so you're starting out and that's a bit too much to manage initially, then 3 days a week is absolutely fine as well. You want to be working to a moderate intensity of exercise, and Ellie's going to explain that a little bit in more detail shortly. And then there's another kind of component of exercise that we really start to focus on these days as well, which is strength training, and we want to be performing that on 2 days of the week. So that's kind of the general guideline, and we'll probably go into a little bit more detail into that today.
Fantastic. I like the way you broke it down. So it's fantastic that if you're starting to do some regular physical exercise, you can just keep in mind that 30 minutes a day, work your way up from 2 to 5, ideally, days a week. And then if you can't manage 30 minutes a day because you're busy with other things, or you're starting out and it's too long, you can do 10 minutes, 10 minutes, 10 minutes, and add it up to 30 minutes. That sounds really doable. Thanks so much, Eleanor. That's great. So, Ellie, say I started off and I decided I was going to do a regular exercise program. How would I monitor my exercise program? And I've heard about the FIT principle, and I thought maybe you could explain that a little bit further.
Absolutely. And again, I think a lot of people out there would have heard what we call like the FIT principle. And so again, what I'll do is work through a couple of those things, and again, what to actually look for. So when we look at the FIT principle, the first one is the frequency. And so Eleanor's touched on that, but for most individuals starting off, especially if they haven't engaged in regular exercise, then starting with 3 days a week, but ideally really building that up to 5 days a week. In terms of intensity, for individuals that have an underlying heart condition and that again haven't engaged in regular exercise, then we would recommend they start with low to moderate intensity exercise. And I'll give some tips and tricks shortly on how we can actually define or better regulate what moderate intensity looks like and how we can gauge that at home as well. From there, those that have started at that regular moderate intensity can slowly start again over time to build that intensity up to more higher or vigorous intensity exercise with that. In regards to time, again, ideally accumulating that 150 minutes throughout the week, and again, starting in small bits across the time. Now, the last T is for type, and so with aerobic-based exercise, we're looking for exercises that get you breathing. So again, a little bit of huff and puff, and they again should be large, like rhythmic movements. So if we think of like brisk walking, again, things like dance or like aqua aerobic classes, again, for individuals can be helpful. Things like cycling. So again, any type that does start to make us sweat a little bit, and again, should be a bit huffy and puffy.
Perfect. So exercises that you're using pretty much on most of your large muscle groups,
Absolutely.
your arms and your legs and that sort of thing, so that you're actually getting your heart has to work a bit harder.
Totally.
Those things. Perfect. So I often, for some of my patients, when we're talking about exercise and they're recovering from a heart event or have had a heart procedure, for some of them they say, well, I have a really active job, so I'm on my feet all day, and they want to know if that counts. How would you answer that? I suppose it depends a little bit on what type of job it is and all that sort of thing.
Yeah, and so again with that, and again we see that question come up, is that most of the time exercise needs to be structured, it needs to be planned, and its goal generally is to improve health and fitness. And so certainly being on your feet or active throughout the day really fits more around what we call physical activity.
Okay.
And so exercise should be an intensity and a planned and structured activity with the ultimate goal of improving fitness. So even though people have been active on their feet and they might have a standing job at a cafe or something like that, it's often still not enough to see the real benefits from a fitness point of view.
Perfect. So it all helps because you're moving.
Absolutely.
But you want to get your heart rate up for a certain length of time at a certain intensity to actually improve your heart muscle
Absolutely.
and get fit, really. Oh, that's perfect. Thank you. So that leads on quite nicely, actually, Ellie. So if I am exercising, how do I know that I am exercising at the right intensity? Because often you hear, your doctor or someone will say exercise at a moderate intensity. What does that mean?
Yeah, absolutely. And again, that's probably one of the biggest questions that we see from patients as well is how do I know that I'm doing the right intensity? And again, there's lots of ways that we can quantify that, but for those listening at home, there's a couple of two methods that we would encourage you to start and try and implement. So the first one is what we call rating of perceived exertion. And so it's a scale from 0 to 10, and it basically is meant to be a reflection of how much effort you're doing for the amount of exercise intensity that you're doing. So when we get people to rate that, again, they should be thinking of how their breathing rate's feeling, how their heart their respiratory rate or the frequency of that, again, things like sweating and other sensations. So if we think back to the 0 to 10 scale, 0 would be doing nothing at all, so us here right now. To 10 would be maximal effort exercise. Now, for people starting off with exercise that haven't done it before and that have some type of underlying heart condition, we would suggest they start low to moderate intensity, and then over time, as long as things are progressing, that intensity can slowly be built up. If we look at 0 to 10, that's normally about a 3 to 4 out of 10, which is moderate to somewhat hard for that level of exercise. A couple of key examples that would be quantified as moderate intensity would be things like brisk walking.
Okay.
Individuals that want to play tennis, doubles tennis.
Yeah.
Other things that would be termed more vigorous. Again, in terms of RP out of 10, you're getting more towards 7 to 8 out of 10. Again, those activities, think about jogging, running, again, swimming laps within pools. Again, tennis can be one, but if you're playing singles.
Okay.
So those are some examples, and same in terms of that 0 to 10 scale. There is another way that we encourage patients to be able to monitor and self-regulate that intensity, and it's what we call the talk test.
Oh, yes.
And so again, some people might be familiar with that, but the talk test, again, from a moderate intensity point of view, you should be able to hold a short sentence or conversation with another individual while you're exercising, but you certainly will notice that your breathing's picked up.
Yep.
In terms of defining what vigorous or higher intensity is, that's normally an intensity where if you and I were exercising, we'd only be able to communicate in 1 or 2 words.
Perfect.
Now, for individuals, again, that are starting off, they need to be thinking about being able to still hold a slight conversation at that moderate intensity before progressing up to anything more intense.
So what about if you can you whistle and sing as well as that? If you can't do that, then you're exercising at too higher intensity? Okay.
Absolutely.
So it's easier to talk, if you can talk a short sentence, you're about at the right level, but you may not necessarily be able to hold a whistle a tune or sing, because that requires more
breathing
rate.
Yeah, absolutely.
Perfect. Oh, that's really helpful, Ellie. So Eleanor, you touched on progression. So strength, as far as building up strength training or resistance training, how is strength training? How should that be prescribed according to this FIT model? How do you do add in some strength or resistance training?
Yeah, great question, and really interesting to note tonight, because I think previously cardiac rehabilitation or exercise, following a heart diagnosis or treatment or event, has traditionally been cardiovascular in nature. So aerobic exercise, what Ellie was touching on about that cycling, that swimming, that walking, that running, and often neglected is the strength training component. It's really great to see that the research is now saying it needs to be prescribed. People need to be doing strength training, and the reason for that is, as we get older, if we allow ourselves to become weaker, and this often is one of the predictors of early death. So it sounds a bit grim, but particularly in cardiovascular disease patients, we see that occurring. At the end of the day, our muscles are what moves us. Our bodies are made to move. And so if we're not training and including strength and mobility work, then we will lose some of the independence to move around without pain and that kind of stuff. So one of the kind of things we say in clinic is we want to be training now for the exercises that we want to be doing in our 80s and 90s, because that's what keeps you independent and keeps you able to move around. Now, if we look at the guidelines for what we should be doing for strength training, as I kind of alluded to at the beginning of the talk, we want to be doing strength training twice a week. If you're new to strength training, once a week is fine to start with. When you get up to twice a week, you want to be putting at least a day's rest in between those sessions, because your muscles can get a little bit sore after strength training if you've ever experienced it yourself. When you're doing your strength training and you're integrating it, you want to be aiming for one set when you're starting of, say, 15 repetitions of an exercise. And in terms of how many exercises, somewhere between 8 and 10 is a really good number. And you want to be considering, head to toe, are you working most of the muscle groups there, so most of the large muscle groups. A really good example of just an easy exercise that I can kind of demonstrate to you is something like a bicep curl. So if you had a weight in your hand down by your side and you're pulling it up towards your face, that would be a bicep curl, okay? So the hard part is bringing it up to your face. The easier part is relaxing it down. If you were to do 15 repetitions of that and you found that it was easy, then you'd need to be challenging yourself in a greater way. So whether that is adding another set in or adding more weight. Now, the good thing is you can do a whole body strength training program at home. We've seen people absolutely, and particularly with the recent experiences of COVID, we've seen people being able to absolutely implement strength training at home using chairs, using stairs, using milk bottles and cans for extra load. So there are absolutely ways to do it that don't necessarily mean that you need to be inside a gym. Now, obviously, a gym has a lot of resistance training equipment in it. It's got your free weights, it's got your machines. But one thing I think that's really important to note is not to be intimidated by that environment. If it's something you haven't experienced before and you want to experience and you've got the means to, then try not to be intimidated by it if you can, because everyone in there is doing exercise for longevity effectively.
Absolutely. So use it or lose it, and you want to continue on to have a long, independent, able, active life. Oh, that's fantastic. Eleanor, talking about that, so just still staying on strength and resistance, or strength or resistance training, are there any special considerations for people with heart conditions or people who have high blood pressure for them to be mindful of or to remember? And I'm sort of thinking, when you're doing strength and resistance training, sort of thinking about things like, I know a lot of strength training these days is tending towards using your body weight, so planking and that sort of thing. Have you got any tips there?
Yeah, absolutely. And I think there are definitely some things to keep in mind when you are incorporating strength training, or you're returning to strength training. Say you've done it before, but you're returning following a heart diagnosis or event. And a few of those are things like not holding your breath. So particularly in, say, those stable, or we call them isometric, but exercises where you're not moving physically. So things like a plank, where you're holding a position in one spot. People can tend to hold their breath, and unfortunately, what this will do is typically it will spike your blood pressure. So that's not so great for your heart. So you want to make sure that you're still breathing throughout any strength exercise that you're doing. Now, this also applies for any moving strength exercise that you do. So if we go back to my example of the bicep curl, we want to make sure that we're always breathing, we're not holding our breath, so we can reduce that pressure. The other things we really want to focus on are technique or form, because we know that if we do an exercise in poor form or with poor technique, then we do risk injury, and that's not a setback that anyone wants to experience. If they can avoid it, form is really, really important to get right. So be critical on your form, ask someone to spot you, or to watch what you're doing, have a look in the mirror, video yourself, whatever means you need to see how you're performing the exercise is really helpful as well.
Fantastic, thanks, that's really great. Ellie, I've had patients ask me, and this is quite common, particularly when they've had a heart event or heart surgery, what symptoms should they be monitoring during exercise that might be warning signs that something's not right? So with their heart particularly, is there something that simple things that whilst they're working away at home, they feel confident in exercising and increasing their intensity and their frequency, knowing that they've got some tools or knowing how to monitor for any warning signs?
Absolutely, and again, that's a really fundamental and important question again that we would see from individuals. And so again, I'll cover a few key ones to certainly be mindful of, and this applies to anyone that's either starting out an exercise regime or is returning to exercise as well post event. So again, things to certainly be mindful of is any angina-like symptoms. Now, angina again for a lot of people can be things like chest tightness or discomfort. Again, other things to look out for is things like lightheadedness, any dizziness that again is getting worse by or being made worse by exercise. Also things like palpitations, so often patients will report that as like they can feel their heart racing, again is something that shouldn't be occurring with exercise. The other one that becomes a little bit more difficult to distinguish for patients is things like shortness of breath. So obviously, as we've just touched on, you do want to be huffing and puffing a little bit, but it needs to be proportional to the activity that you're doing. And so again, absolutely, climbing up 2 flights of stairs will generally make most people huff and puff, but if you've done it before without any issues and then you start to notice a change, that's something again to be mindful of with it. So again, with the breathlessness, expect there to be some normal breathlessness with the intensity increasing, but if it feels disproportionate to the effort that you're doing, then that should be another sign. The last one that often gets missed by patients, and it might be on reflection that they start to notice it, is that if you have been in a regular exercise routine and that you've been doing it, for example, for 3 to 6 months, and you've been doing one loop of a walking track that you always do and you race through it in the same time, and then one day you go out to do it and you just can't get through it, or you're starting to notice that you have to go slower and slower and slower to be able to do it. That's not a normal sign. So if we are regularly engaging in exercise, we should find that our fitness is actually improving. Yeah. What happens again in individual, if you've had 3 months off and you go back to it and it's hard, that's probably more related to your fitness, but certainly a regression without a change in what your exercise routine should be another red flag. Now, in instances on how to deal with this, with any of those abnormal symptoms, you need to be stopping the exercise. Again, if you've been prescribed like GTN spray by your cardiologist, then you need to be implementing what your angina action plan is from that stage. The other thing then is obviously a consult either back to your GP or a direct consult back to the cardiologist for any abnormal signs or symptoms during exercise.
That's a really good point, Ellie, because certainly I've had patients come back to me saying, I can normally do this and I've been doing it every day or every second day for months or years, and then suddenly I felt unusually or abnormally fatigued doing it, really tired or really short of breath, and I just thought maybe I was just getting a bit older. But don't take advancing age. There's a reason, particularly if you have been doing it regularly. If it's unusual, then you can normally do it. It is a warning sign to talk to your GP or cardiologist.
Absolutely,
that's really, really good and really important point. Eleanor, are there any, and we sort of touched a little bit on this too, but I think just to go into a bit more detail about, are there any exercise considerations or restrictions for people post-surgery who've had things like a pacemaker inserted or sternotomy, so the breastbone cut for open heart surgery, maybe a pacemaker, ICD, that sort of thing? What special considerations do they need to think about before they start their exercise?
Yeah, absolutely. And while what I was discussing before is more about the general considerations of strength training with heart disease, when we look at the specifics, it does change per condition, and that's why it can be helpful to seek some advice. Where if you're returning post sternotomy, so you've had that breastbone cut open, then things like strength training on the upper body are off the table for 12 weeks. you can return to some light to moderate like range of motion exercises and light strength training around the 4 to 6 week mark, and that's typically coincides with when you've had post-surgical review or sign off from the surgeon typically, and then graduate your way up into that heavy or moderate to heavy strength training around the 12-week mark, because that breastbone just needs time to heal. And that also needs to be in the presence of also the absence of other symptoms as well. So just making sure that the movement feels okay. There's no unusual sounds or feelings or sensations. So that would be something good to bring up with the GP or nurse or anything like that if you did experience those. Around implantable devices, so things like pacemaker, ICDs that get inserted, there's definitely a restriction on not doing any exercise above the shoulder level for 4 to 6 weeks post, just because that will risk, taking, those leads becoming detached. So we want them to stay in place. 4 to 6 weeks, nothing above the shoulder level.
Just while it's healing, to ensure that those lead placements stay where they are and don't move out of place. So that's exactly right, Ellie. I just had a quick thought when you were talking about people with needing, after sternotomy and that sort of thing, as far as heavy strength training or resistance training goes, they can still do some walking, right? So we're not saying don't do anything for the first 6 to 12 weeks. We're saying don't do any strength or resistance training until you've got clearance. So usually at that 6 weeks when you go back and see your surgeon, until you've got that clearance, but you can start your walking or other type of exercise regime.
Absolutely. And what you'll find if you're due for that procedure, or if you've recently had it, you'll find that you're probably asked to do stuff pretty quickly after as well. So you'll be doing breathing exercises, thinking of ways to protect your chest when you're doing common things like in the car, sneezing, coughing, that kind of thing. And then that progressively graduates to some light range of motion exercise where you're starting to take your arms away from your body. Over time that progresses into light weights or pulling your hands up towards your faces. But again, it's all graduated, it's small progressive steps, and if you have any trouble with any of those steps along the way, then it's a good time to check in with your medical team or cardiac nurse or whomever it is.
Yeah. Perfect, thanks Eleanor. Well, that's us as far as giving you a little bit of information about exercise after a heart event or surgery. So thanks Ellie and Eleanor for sharing so many great tips and tricks and advice on getting back into exercise and just making it a little bit more reassuring for those people who are watching this, and also their family members and spouses, because I also find it's often the husband or wife or partner of the person that's had the heart event or surgery that's the most scared and wanting to look after and protect their loved one and worrying about how much exercise they do. So hopefully that's alleviated some of those fears and given you a little bit of guidelines about what you can start off doing safely and that you can do that on your own. So thanks to everyone watching. We've got some questions here. So I think the first one we've got is from Janine. Janine asks, what about having an ICD and exercising our chest workouts with weights okay? And I suppose it depends on when.
Yeah, absolutely. So like I mentioned before about the implantable devices, nothing for 4 to 6 weeks above the shoulder height. But the other thing with ICDs is you have obviously a heart rate at which the ICD will go off. So what you need to be aware of is what that upper heart rate limit is, and you need to be exercising at least 15 beats below that. So for instance, if it was set to go off at 180 beats, then you'd want to be exercising at no more than 165. Now it's probably unlikely that during weight training that you're going to be at 165 beats per minute. Perhaps you might be, I'm not sure. But what you would want to be just ensuring with that exercise with weight training is that there's probably no contact with the defib itself, so avoiding contact where possible, and just sometimes if they're in different places, then just making sure that it feels comfortable with the exercise.
Perfect, thanks, it's really nice and clear. Thanks Eleanor. And Yvonne asks, how soon after open heart surgery should you start exercising? Good question, Yvonne, because I expect a lot of people are asking that same question.
Absolutely, Yvonne. Again, a really good question that commonly comes across. So again, in regards to, as Jane kind of touched on initially, you actually will be up and moving in regards to aerobic exercise quite soon after open heart surgery. So again, initially you'll need those first couple of weeks. It's again a big operation to go through to recover. Again, you probably won't feel like doing a lot, but you'll absolutely be recommended within the first couple of weeks to get out and start walking. Now, that walking won't involve hills, so it will be at that more low to moderate intensity. And again, that's absolutely a good starting point with that. For anything in these initial stages, it's more important to start increasing the duration of the exercise, the aerobic exercise that you're doing before increasing the intensity for that. Again, from it in regards to the strength training component, certainly we'll leave that side of things for any upper body, at least till about that 12 weeks post. But you should be up and moving as soon as you can tolerate, really.
Perfect. And I certainly say to my patients, start off with some short walks. It might just be around the house. If you live on a hill, hopefully you've got someone around that can drive you down to the flat or somewhere beautiful, and you can just spend 5-10 minutes walking quietly and slowly along a flat place with a beautiful view, so that you're out and about for those first 2 weeks. I also suggest you have a rest in the afternoon and limit your visitors. But that's on another more wider topic. On to the next question. Daphne says, I'm about to get my second new defibrillator as the battery is running low. In the past 15 years, it's been nearly impossible to find a relevant exercise regime. What are the safe, relevant exercises, please?
Yeah, so maybe rounding back to that conversation we had about implantable devices and ICDs previously, anything in the lower body is absolutely fine straight off the bat with exercise. So if you're going for a walk or doing some cycling, that's absolutely fine. But keeping note of what that upper heart rate limit is and making sure that you're exercising no more than 15 beats below that. Okay. Sorry, not within that 15 beat bracket.
So you go to minus 15.
Minus 15.
And that's your maximum.
And that's your maximum. Exactly.
So you can get that information from your outpatient cardiology pacemaker technician.
So you'll typically get it at a pacemaker clinic visit, or if they've been able to do any kind of telehealth with you, you can always ask, and that should be something that they are informing you of, and if they don't, please do inquire what it is, because it is important, really important to know that you don't want to risk it going off if you can help it. And then obviously you can do lower body strength training, you can do upper body strength training after that 4 to 6 week period above the shoulder height. There's probably stuff that you can do under the shoulder height before then, as long as it's not moving that shoulder girdle too far from neutral position, because we just don't want those leads to dislodge. But exercise is still very, very beneficial.
Oh, that's fantastic. That's very reassuring. Thanks, Eleanor. Kieran asks, how do you advise someone start with strength training at home? Is there an info online, or is it necessary to see a professional? So this is the strength and resistance training component, which I think for most people is quite new. I think we think about walking and running, so this is really important that we've touched on this today.
Yeah, I think the best place to start with strength training, if you are new to it, is with body weight strength training at home. So there are resources that are free to access, things like YouTube that have exercising videos on them, and you could say search things like low intensity strength training at home, and do things like sit to stands, getting up out of a chair, doing things like push-ups against a wall, if you're not obviously in that acute phase post anatomy. You don't necessarily have to see a professional. It is helpful to get some guidance, especially around form and technique and making sure that you're doing the exercise right. You might have someone in your family or whānau that has that knowledge, so tap into the people that you have around you, your community, and see what resources that you do have. But it's absolutely fine to be starting online as well, as long as you're not injuring yourself.
Perfect. That's really great. Thanks, Eleanor. And do you have any general advice around exercising for people who have had SCAD, heart attacks, or is this a question for the cardiology? And we can define SCAD.
Absolutely. So again, whoever has had this question, it's honestly absolutely wonderful, a wonderful question. And for those that don't know what SCAD is, it's spontaneous coronary artery dissection. So it's a different type of heart event to what someone would have if they have coronary artery disease, where there's a blockage within the artery. It's a condition that typically will affect females with a higher proportion, and unfortunately a lot of our research around SCAD and exercise is still right at the forefront around providing specific guidelines for patients with SCAD. So there's been some beautiful research work that's been put out by the Mayo Clinic over in the US, for those that don't know. And again, we're just starting to understand a little bit more around what's safe within that group. The reason that there's some more precautions around it is that individuals post-SCAD have a higher risk of future dissections, which again, and our caution around it is because of exercising blood pressure. So when you exercise, your blood pressure will need to increase, because we've got to pump more blood around to exercising muscles, and that's normal. With patients with SCAD, if there is access to, then it would be really helpful to have an exercise assessment for patients with SCAD to try and get an idea of how your blood pressure is regulated during exercise, to provide some more specific guidelines around what that intensity looks like. So again, it could be absolutely, like as clinical exercise physiologists, we see patients for exercise rehab post-SCAD, and again provide that guidance and supervision, especially in the initial phases of returning to exercise. Again, your cardiologist can also certainly be a really good resource around that. A couple of probably extra points in regards to, there's certainly some evidence around other things too.
There is some general advice of what not to do, and that typically includes like high intensity interval style training, and training where you might be changing position quickly, particularly around like your upper body or your neck. So things that require you to change position or turn your head quickly are typically off the cards, just for risk of recurrent SCAD.
You got any examples of exercise that you would do? So the rapid interval training, is that things like those 45 or those
it can be
programs that you go from one thing to the next really quickly, and you're doing a whole lot of different types of exercises.
It can be that. It can be even things just like if you think about a sport that you might play, something might be like indoor netball, which is really start-stop. It's really turning your head, turning your body. And that kind of thing can put you at risk too. So it's just about reassessing the things that you love, and seeing if there's a version that you can do that's not high intensity and potentially without that positional change.
Perfect. And I'm hearing that ideally it would be great to have an assessment so that someone who is trained is able to monitor your blood pressure whilst you're exercising to see what's happening there. That's what we need.
And the only other thing to touch on that is it's certainly still not recommended to do again heavy strength training with SCAD. So again, some light to moderate intensity for the resistance, but you shouldn't be exercising that the last repetition is the last one you can do. That's certainly too much in terms of intensity at the moment for that.
Stop a little bit earlier.
Absolutely.
That's fantastic. So Lynette's has had a heart event, and she's worried about restarting her exercise regime. So Lynette's, obviously you've already have an exercise program or regime that you used to do, you've had a heart event, and you're like, oh my gosh, should I be, where do I start and how do I restart? And she's also asking how to manage that anxiety, or her anxiety about restarting the exercise regime. Got any good ideas or tips or reassurances?
I think the first thing we need to do is just normalise anxiety following a heart event. It is incredibly common, akin to experiencing depression as well. It is very, very common to have fear about returning to exercise, or just a lack of trust in your body perhaps following your event or your diagnosis or treatment or whatever it has been you've been through. So I think recognising that is a really big step, first of all. Now, one of the things that is really helpful for managing anxiety is exercise. So it's if we're able to get it in, even in the low intensity volumes, it can be really helpful for just quietening down our body, to be able to feel like a sense of success without any, lingering symptoms or anything like that. So if you are able to get out for regular walks, that's really helpful. Another really good thing to do if you're struggling with anxiety following is socialization. So exercising with a buddy, find someone to go and walk around the block with. It might be someone in your whānau, it might be someone in your community, it might be someone that you used to go to the gym with who loves exercise as well and is just happy to be there. It's a good time to be a sounding board, to talk about your about that anxiety, and what you'll find over time is that typically breeds a bit of confidence in your body. You're starting to trust your body again. You've gone from walking on the flat to then being able to walk up some slight slopes or a set of stairs or something that you might have done quite easily in the past without that anxiety. So hopefully that's a couple of tips there of how to work through it.
That's fantastic, Eleanor. And yes, absolutely, it's almost unusual not to feel any anxiety either returning to exercise or starting exercise, because of course you worry about whether this is good for your heart. And I guess the very short answer is yes, it's very important. In fact, it's more important to exercise than not exercising. You can do more damage and are more likely to have a future event if you don't exercise. So we need to look after that heart and do some safe exercise. Joseph wants to return to higher intensity exercise but is worried, and that's a really good point too. So can he do higher intensity?
Yeah. I think, again, Joseph, that's a fantastic question, and I don't know if I can answer it fully, but I'll do my best. But I think, again, it's acknowledging that most people coming back, there'll be that anxiety around what level of intensity is safe and is appropriate with it. Again, just think back progression. So if you are looking at starting to implement higher intensity exercise, it really should be in consultation with like a trained exercise physiologist or other allied health professional preferred. And again, it should probably also be in consultation as well with your cardiologist and GP, because there are different conditions. We've seen lots of people on our end that have had heart disease that have returned to quite high intensity exercise and endurance sports and things like that. So it's certainly not out of the question, but it is something that should be assessed before making those steps forward. And without having all of the information in regards to what your heart condition is, it's hard to provide any certainty on that. But the thing is, start moderate. Again, if you're not experiencing any of those symptoms, gradually start to build up the intensity. And same thing, just closely monitor symptoms. Again, if things are still feeling okay, then all going well, then often people can still return to those higher intensity activities.
That's really reassuring, Ellie. And without giving too many details away, we have both know of a really good patient or friend of ours who has had heart bypass surgery and returned and just recently finished an Ironman just this weekend. And he was prior a regular Ironman competitor. So congratulations out there. And just that reassurance that it doesn't necessarily, if you have a heart event or need a heart procedure, it doesn't necessarily mean that you can't get back to what you love doing. For some it will be having to alter what you do, and for others, yes, absolutely, with guidance from your health professionals, you can get back possibly to your regular, what you used to do before.
Totally.
Awesome. Now Chanel wants to know, what is the best type of exercise for people with high blood pressure?
Yeah, thanks, Chanel. That's another good question. There's some really good ones coming through tonight. Look, traditionally, if we took a lens back across the research, it would be saying that cardiovascular or aerobic style of exercise is really good for managing high blood pressure. Again, some caveats here. Depends if your blood pressure is like controlled. So are you on like appropriate medical management, or is it what we would say uncontrolled, where there's no medical management in place and it's sitting at a high level. But what we do know physiologically is what happens in the body with cardiovascular exercise is that following a bout of like aerobic exercise, so walking, cycling, whichever, typically your blood pressure will be lower following that exercise period than when you started exercise. So it has like a really good, what we call systemic effect on the body for lowering blood pressure following a cardiovascular or aerobic exercise session, and that can last for a day or two as well, which is really good. So if you think about getting that accumulative dose, or like, say if we're getting that 30 minutes a day or 5 days a week of exercise, then we're getting those positive effects on our blood pressure throughout the whole week, rather than say, we think of maybe our weekend warriors who do all of their exercise on a weekend. We just get that benefit at that time, and not for the weekdays. Cardiovascular exercise is really, really helpful for managing high blood pressure. But similarly, there's, again, a lot of evidence now backing resistance training or strength training, and certainly there's no, if strength training is done appropriately, there's no detriment to blood pressure if with strength training if you're doing appropriately. So, yeah.
Perfect. So, if you want to manage your blood pressure, and as well as taking medication if you need medication, to do that regular exercise more frequently is going to be more beneficial than just doing one big load of exercise one day on the weekend.
Absolutely.
So it's going to keep your blood pressure lower for longer.
Yep.
Fantastic. Harry asked if there are any tools to help him track his exercise progress. Really good question, Harry. There's so many tools out there, but Ellie and Eleanor know most of them, and I only know a few of them.
Again, a good question, Harry. This, again, it probably depends what you're trying to track. So a couple of things for aerobic-based exercise is if you've got access to a heart rate monitor, that can be really helpful. Again, also things like tracking your distance and your time, because you should, as your fitness improves, you should be able to complete the same walk or run at a quicker intensity for a similar or a lower heart rate response, because as we get fitter, we see heart rate lowering for the same exercise intensity that we're doing. So keep a note of, it sounds silly, but keep a note of what you're actually doing in regards, whether it's walking, whether it's cycling. Cycling, you can use, again, distance, or a lot of gym bikes and stuff have watts on them as well. So you can track your watts, which is just the intensity or power output, and again, track things like your heart rate over time, which again, you should then see a trend that you can do more for a lower
heart rate.
Exactly.
The stronger your heart muscle is, the less often
like it has to work
pump to get the same amount of blood out, because it can squeeze harder, so it doesn't need to pump as often. And that's a sign that you're getting fitter.
Absolutely.
Generally, obviously, if you are depending on what medication you're taking as well.
Yes.
There's medication that can lower that heart rate as well.
And another thing I'd just add there as well is if you're new to exercising and you don't, say, have a heart rate monitor or whichever, within most smartphones, there's like a health app which tracks like steps that you might be doing throughout the day. So one thing that can be really helpful to do is have a look back at how many steps you've achieved on average, say, in the last week or last month, and say if you're setting some goals to improve that, maybe try for another 1,000 or 2,000 steps per day, and just see how that accumulates, because although that's working to just getting moving more, if we're more intentional with that movement, sometimes we'll put that into an exercise session or something like that. So just those little tips that can be really accessible for everyone are helpful too.
That's a great tip, actually. That's really good. Kaylee has mild heart failure, and she'd like some tips on setting exercise goals.
Look, we're seeing a lot of heart failure in clinic, and there are definitely some things that need to be considered when you're looking at setting an exercise program or whichever, and a lot of that is around how you're feeling, so what your symptom burden might be, and just making sure that obviously your heart failure is really well medically managed and you're on optimal therapy, but when you're looking at setting exercise goals, you want to make sure that they're really achievable, that they have a bit of a challenge in them, so not too easy. They're something that can be achieved in the short term, medium term, long term, so you've got little stepping stones to get there. But when it comes to heart failure, making sure that, just smaller chunks are probably more helpful more frequently. So one of the things that we might implement with some of our patients would be, for instance, with an exercising program or a day, would be breaking up their, say for instance, cardiovascular exercise into, say, doing 3 minutes of cardiovascular exercise and then a couple of minutes of rest, followed by more bouts of the same, just to help kind of break it up so we're not getting, we're not experiencing maybe as many symptoms of breathlessness or fatigue or whichever. I'm not sure if that's answered the question. Ellie, do you have anything to add there?
Oh, I think you've covered. You've covered most of it on that front.
Yeah, I think with heart failure, and you've said that it's just mild, that it doesn't, as long as it's well managed and it's under control, and you have very few symptoms, which if it's mild, you're unlikely to have. It doesn't really restrict you a lot, other than perhaps having those maybe slightly more broken up rest periods. If you have more severe or moderate heart failure, then it's really important that if you have a sudden exacerbation of that, so a sudden episode where you need to go into hospital or change your medications, increase your medications, or add some water tablets, frusemide or something like that to get rid of extra fluid, that you wait until it's settled down again and to start again to do your exercise, and maybe start at a lower level again. So, but certainly for mild heart failure, not a lot of extra restrictions, I don't think, or precautions. Just keep up that exercise, because actually with mild heart failure you can improve your heart failure and or at least keep it mild by regularly exercising. So really important. Aleki asks, for people with heart issues, are there any specific warm-up or cool-down exercises? Really good question, Aleki, because there's been a lot of controversy lately, isn't there, about whether you're supposed to still do them.
Yeah, a great question. And absolutely, again, a warm-up should be without a doubt in everyone's exercise program, and it becomes particularly important with people with coronary artery disease or symptoms of angina, because what we know is that if they do a prolonged warm-up, so most people are okay at about 5 minutes for a warm-up as a recommendation, and again, for people though that suffer angina, what we would tend to see, and they do better longer through the session, is actually an extended warm-up period. So we would encourage them to start out for about an 8 to 10 minute warm-up for those individuals, and it just allows more time at those lighter intensities for those blood vessels to dilate and allow more blood flow before we increase the exercise intensity, which increases the demand on the heart for extra
less
blood
chance
flow.
of angina episode
Absolutely.
happening, because you're giving your heart chance to warm up in your arteries to be able to carry more blood. Yeah, perfect. Any specific exercises?
Aerobic based.
Okay.
So again, anything like your cycling, walking, light intensity shouldn't make you huff and puff. Yeah. In regards to cool down exercises, predominantly again, same with your aerobic base. You shouldn't ever stop suddenly, especially if you're doing a moderate or higher in intensity. It should always be followed again by about a 3 to 5 minute cool down with it. It allows blood pressure to come down gradually, and it often will mitigate any dizziness that happens. What happens sometimes if we stop completely, we get all of our blood that pulls to our feet, and again, sometimes that can be a contributing factor for like low blood pressure and then also dizziness as well. So again, just remember, warm up gradually, do your exercise bout that you're doing, and then finish off with a couple of minutes of a cool down.
Perfect. And that's because much of your blood circulating is diverted to the muscles that you're needing to exercise. And if you're running and then you suddenly stop, it's still in those muscles and around that area, so it suddenly drops and you get that dizziness or lightheadedness. Really good explanation there. Thanks, Ellie. Anna asks for exercise tips for someone with low blood pressure. Good question, Anna.
And that really nicely segues off what Ali was just talking about. So definitely the extended warm-up and cool-down are really helpful for managing low blood pressure. But there are other things within the exercise environment that people who experience low blood pressure should be considering, and that's things like hydration, making sure you're really well hydrated before you exercise, trying to avoid exercising in the peak like heat or humidity of the day, because that's massively zapping for energy levels. And I think when you're exercising, if you are feeling faint or dizzy, obviously stop, but within the exercise program anyway, if you just generally have low blood pressure, you can help manage that by doing more recumbent style exercises. So for cardiovascular exercise, it would be things more like swimming, more like rowing. There's some bicycles that you can sit on that are more like recumbent in nature, so you've got a little bit of lean back. And then similarly for strength training, choosing options that are more that are closer to like a lie flat option rather than big from the ground to the ceiling exercises.
On the ground.
Exactly. It just reduces the change that your blood pressure has to go through to meet that demand.
So what about a couple of things? Would you encourage, and it depends on the type of exercise you're doing, electrolytes to just help rebalance? Absolutely. So that would be things like you do, your classic one that you probably wear of is things like your Powerade, which are also full of a lot of sugar, but hopefully we don't have any endorsements by them. But there are like electrolyte sachets that you can get them prescribed them, you can pick them up in the supermarket. There's a lot of electrolyte drink options out there. Adding salt to your food can be helpful as well.
just that helps to bolster your blood pressure a little bit.
That's just for people with low blood pressure.
Yeah.
So if you have heart disease, you want to lower your salt. So please don't add that to your
Absolutely.
No, that's also Ellie. And the other thing too, I've been encouraging my patients to do, particularly those who have syndromes like POTS, postural orthostatic tachycardia syndrome, or orthostatic hypotension, is to wear those leggings.
Compression,
Maybe not
absolutely.
necessarily compression stockings, because people hate wearing those, but those tight fit leggings help to bring the blood up from your legs and reduce the risk of
low blood pressure
episodes.
Yeah, exactly. Just helps to return that blood to the central part of the body rather than pooling in the feet, as Ellie was saying. Another thing you can do is prime your muscles. So before you say you're sitting and we're doing an exercise sitting, or you've just been sitting all day at your desk or whichever it is, you can prime your muscles by just raising your heels off the ground, so kind of going onto your tippy toes. Can't see me doing it, I'm doing it, it's silly. And that can just help getting some blood flowing, getting rid of that pooling before you stand up, and that can really help to get some blood pressure up.
Thanks a lot. Good tips. And this is our last question. So David is really busy and he struggles with motivation to exercise, and I think we all have felt like that at various times of our lives. So thanks, David. Really, really true, particularly in this day and age. Any tips for fitting exercise into a busy schedule and maintaining it?
It's a tough question, I think.
Find the answer, let us know.
The first thing I'd like to say before Ellie answers it is it's okay to have periods where you stop exercising because you are ill, because you are too busy, because something else has had to take priority or precedence. Don't feel like once you stopped you can't start. It's normal, and very few people in this world manage to continue a regular exercise regime without ever stopping through the entire life. So it's okay to have stops and starts, but obviously the fewer the better. Yeah.
Absolutely. Again, I think Eleanor touched on it at the start. I think, David, if you haven't already, try and find an exercise that you enjoy. So again, don't just stick at something because someone's told you that that's what you need to do. Again, there's no point doing the best exercise prescription or type of exercise if it's something that's not motivating or you're able to actually stick with it. So again, first off, just reassess what you do enjoy. And again, secondly, I would say start small again. So, set your goal of, even if it's once a week, starting to reincorporate what that routine was, and then set yourself some goals. And so they can be short term. So again, you might have a goal for the next 3 weeks that you're going to do that regime like once a week, and then see how you go with setting that up again. In regards to trying to fit it in with a busy schedule, I absolutely appreciate that. Again, life these days, there's a lot going on to manage. If you can fit it either like before work, lunchtime, or after work, think with the after work, often it's easy to just get in your car and go home if that's what you're doing. If you can incorporate it on your way home, again, it stops you actually getting home and then stopping and then having to motivate yourself to get out. That'd probably be my couple that I would.
And I think anecdotally with people that we've worked with, sometimes it's just like putting the equipment on, get your gym gear on or your walking gear, put your walking shoes on, and then once you're out the door, typically you'll just find your feet will take you somewhere. So just sometimes getting in costume can be part of trying to find some of that motivation to get out the door. And yeah, like Jane said initially, don't beat yourself up if you've missed your exercise for the last week or month or however long it's been. You don't have to wait for a Monday to start it. It's just start whenever you can. Get back into it.
Yeah, I totally agree with you. I, for myself, put my exercise gear out the night before, so that when I get up and I start to think of excuses in my head about why I shouldn't do it because it's too dark, wet or cold, if it's there set up for me and I start putting it on, I will go. If it's not set up, I won't, or less likely to. So just some little tips like that really helps. So that brings us to the end of tonight's session. Thank you so much, everyone who has joined us this evening, and a huge thanks to Ellie and Eleanor for being here tonight. You've been amazing and with a lot of really important and helpful tips. So to everyone watching, thank you for joining us. You asked some really, really great questions, and I hope you found this session useful and reassuring to start on your exercise journey or continue your exercise journey. Goodbye, and we look forward to seeing you next time.